Good afternoon, everyone. Thank you for being in space with us. On behalf of Bradbury-Sullivan LGBT Community Center, I'd like to welcome you to our final session of the 2023 Pennsylvania LGBTQIA Virtual Health Summit. My name is Ashley L. Coleman, and I use she, her pronouns. I'm the Executive Director of Bradbury-Sullivan LGBT Community Center. The theme for today's session is Taking Pride in Tobacco Cessation. Today, you'll learn about new LGBTQ-specific cessation campaigns and discuss the current perspective on tobacco use among LGBTQ Pennsylvanians. At Bradbury-Sullivan LGBT Community Center, we're well-versed with the predatory marketing tactics that the tobacco industry has placed on our community. They spend billions of dollars each year aggressively marketing their products to our LGBTQ populations, flooding our queer spaces with commercial tobacco advertising. I'm incredibly grateful that we all have the opportunity to have this discussion within Pride Month. Pride Month is about love, visibility, and true queer joy. For activists and organizers, this month can be tiring with an abundance of rainbow washing. Big tobacco companies have made their logos rainbow for the month, yet their predatory marketing tactics remain. Being an LGBTQ+ ally means not just performing allyship, but practicing it. Bradbury-Sullivan LGBT Community Center celebrates Pride 365 days a year, and our team tirelessly travels the state working to disrupt big tobacco's influence on our community. LGBTQ+ tobacco use rates are 40% higher than the general population and is one of the leading causes of death in the LGBTQ+ community. There is a critical need in our community for affirming health services and resource sharing. All of you are part of that today. At BSC, our team provides direct outreach to encourage tobacco prevention and support LGBTQ+ smoke-free spaces to reduce the social pressure to smoke. We offer free tobacco prevention workshops to schools, colleges, and community organizations throughout the state of Pennsylvania. This work is important, and frankly, it is necessary. At BSC, we are grateful to have all of you on this journey with us. It is now my pleasure to introduce one of our partners in this work and our keynote speaker today, Brian Zepka. Brian uses he, him pronouns, and he is the research manager for the Electric School Bus Initiative at World Resource Institute. He manages research activities that advance the initiative's goal of an equitable transition of the US school bus fleet to electric by 2030. Prior to joining WRI, Brian led research and evaluation projects at Public Health Management Corporation in Philadelphia, focused on tobacco control and environmental health. He also worked for the Centers for Disease Control and Prevention, where he provided technical assistance for community-based health literacy and youth development programs. Brian holds a Master's of Public Health and a BS in Biology. Currently, he is pursuing his doctorate in environmental health at Johns Hopkins University. Outside of WRI, Brian is also a published author of young adult fiction. Brian, thank you for joining us today, and I'll turn it over to you now.
Great, thank you, Ashley. Hi, everyone. Thank you so much for having me today. I'm really excited to be here and speak with you. I worked in the Pennsylvania tobacco space for a while, so it's great to stay connected with everyone who continues to work on this very important issue and specifically talk about its intersection with the LGBTQ community, of which I am a proud member. Next slide, please. So before we get started, I wanted to say happy Pride Month, everyone. It's even better that we get to talk about this during June and Pride Month. This is a very important Pride, which is a bit related to my overall topic that I'm going to be talking about today, but I'll share more about that soon. But I hope everyone who identifies as queer and our allies are taking some time to celebrate the month. Next slide, please. Oh, one back. Yeah, thank you. So I had a wonderful introduction. So my name is Brian Zepka, and I use he, him pronouns. I wanted to start off with expanding upon that introduction a little bit, when I was younger and navigating the public health field, I always found it helpful to hear about people's career journeys and educational backgrounds, especially as a gay person navigating the professional space, since the field is so broad and there are so many different routes to take. I feel like that transparency is important and helpful for the next generation of public health workers. I'm always happy to chat about anything I mention here, and my contact information is at the end of this presentation. So if you'd like to reach out, please feel free to do so. So I'm a Pennsylvania native, born and raised in the Philadelphia suburbs, Clifton Heights in Delaware County and Westchester and Chester County to be exact. I went to Westchester University for my undergraduate degree in biology. At the time, I knew I liked science, but I wasn't entirely sure which career path to take. I thought about clinical medicine, but then I started taking some environmental health and epidemiology courses, which then turned me on to the field of public health, which is then why I decided to go get my master's degree at Thomas Jefferson University in Philadelphia. And then I'm also pursuing my doctorate at Hopkins, as Ashley said, and I'm completing it part-time while I work. So I still have a while to go until that's finished. I always get questions like, oh, are you in Baltimore or where are you? But I have about 2 years of classes complete and I'm really liking it. It's actually geared toward working professionals. So everyone in the program is also working full-time, which certainly helps with group projects and camaraderie. And I didn't know programs like that existed. So I wanted to share that. And if you're interested in continuing your education, but also want to keep working, I would definitely recommend that program. And then as for my career, my first professional role was at the Chester County Health Department in environmental health as a public bathing place inspector. So I did the pool inspections, coordinated all of the annual complaint and follow-up inspections to ensure that sites were maintaining compliance with county water standards. Then I moved to the Centers for Disease Control and Prevention underneath the Public Health Associate Program, also called the PHAP program. And Ashley went over a little bit what I did there, but I was actually assigned to the Portsmouth Health Department in Portsmouth, Virginia. So I was based with the CDC, but then assigned to a local health department in Virginia. So very great program for professional development. Then I moved to PHMC. So shout out to all the PHMC people on the call and who worked on the LGBTQ needs assessment report and survey. Super important, dedicated team. And this is where I did a lot of my tobacco prevention and control work. And now I'm at the World Resource Institute, focused a little bit more on environmental health. And then, as Ashley mentioned again, I'm also an author of queer young adult fiction, which has been great because it ties me to LGBTQ youth in an interesting and fun way. I get to do a lot of school visits and library events where I get to be present and advocate for representation and queer stories, and also just provide advice. So it's really, really great. Okay, next slide, please. So now I know this is the fourth installment of the Health Summit, and there have been a lot of great presentations so far on social determinants of health, mental health, and community connections. And there was even a little bit of a discussion already about tobacco and the tobacco industry's influence, which was great. When I was planning for this, I reviewed a lot of these presentations and the data in the health needs assessment to help me think about what I wanted to talk about today. And then while I was doing that, I kind of drew from my research experience, work in tobacco control, conversations with the planning committee, and really a lot of influence from Pride Month and current events. And so what I kept coming back to was the youth and the LGBTQ young adult population. And from my research work, a talking point that always sticks with me is that almost 90% of adult daily smokers start smoking by the age of 18. So ensuring that we mitigate and prevent that first attempt at smoking is just so crucial. And so my presentation today is going to be about youth, specifically LGBTQ youth, because they are at a serious crossroads right now. And when I say crossroads, I mean just at a point of unknown regarding how to deal with the deluge of stressful situations that may influence them to try nicotine or tobacco products. And I'll be talking a lot about the intersection of mental health and tobacco product use. Christina, you can click once. Great. So then if you look at the image on the left, we have kind of our classic 4-point intersection. I'm using this analogy to kind of set up this talk. And if you're driving and you approach this intersection, you know what to do. You look left and right, left again, and then you go about your way. And this is how I'm thinking about some of our well-established intersections between queer youth and tobacco. For example, some social determinants of health like unstable housing and stressors from the coming out process, and how they contribute to health disparities and inequities related to tobacco. We have evidence-based programs like our helplines. We have extensive literature documenting this, lots of policies to propose and enforce and help these kids navigate this intersection. Christina, you can click again, please. Thank you. And then, but now in recent years, the intersection is beginning to look a lot like the one on the right. It's entirely new and overwhelming. And if you approach this intersection, you're most likely going to stop and be like, whoa, where am I looking? What do I do here? How can I get through this safely? And this is where a lot of our LGBTQ youth are at right now. And they are asking themselves those same questions. Next slide, please. So what are these new intersections? Well, I'm going to walk through a few of the ones I believe are important and influential in the tobacco space, and hopefully demonstrate a bit of the breadth of these new stressors and how they may be impacting and influencing the attitudes, health behaviors, and choices of LGBTQ youth. So stick with me as I walk through these collisions, as I'm calling them. And the first is climate change and its associated climate crises. So these images may be confusing for you because on the surface, they show what is a very happy and proud moment for youth, which it is. But why am I showing this? Well, more context of these images is that these images are of the Westchester Area School District's high school graduation ceremonies in Pennsylvania on June 7th and 8th, when smoke from Canadian wildfires drifted hundreds of miles southward and created toxic air. On these days, the air quality index was upwards of 300 and in a hazardous range for everyone. I know leading up to these ceremonies, there were discussions about postponing or moving the ceremony, which you can imagine the stress that caused on kids. And then all of the physical effects that could be resulted from this air exposure. So this is one example, and I could give a whole presentation on all the converging climate crises with a teenager's daily life. And kids have very little power to limit its harm, which makes them vulnerable to this new topic of climate anxiety that's having real impacts. So next slide, please. So researchers in the UK conducted a survey of climate anxiety among 10,000 youth in different countries. And these countries were chosen to reflect populations from a range of cultures, incomes, climate vulnerabilities, and differing intensities of climate-related events. And they found that young people report climate anxiety and other distressing emotions and thoughts about climate change that impact their daily life. And this distress was associated with beliefs about inadequate governmental response and feelings of betrayal. A large portion of children and young people around the world report emotional distress and lots of complex emotions like feeling powerless, helpless, despair. And then large numbers report experiencing functional impacts and have pessimistic beliefs about the future. So in this survey, 75% said the future is frightening. That's 75% out of 10,000 kids. And over half said humanity is doomed. And over half said that they believe they wouldn't have access to the same opportunities as their parents. So on top of typical teenage stressors, there is this new issue to deal with. Next slide, please. The next collision is school safety for LGBTQ youth. So the past year has been a very turbulent time for queer youth in their schools, as there have been active campaigns against them and their school organizations and safe spaces that they have worked hard to create, like the library and their gender and sexuality alliances. On this slide are just a few news clippings that I've taken from stories about these anti-LGBTQ policies in schools throughout Pennsylvania. There have been attempts to remove pride flags, queer books, and queer themes in curriculum. And Florida has received a lot of attention for prohibiting classroom instruction of sexual orientation and gender identity, but there have been such bills introduced here in Pennsylvania as well, like Pennsylvania House Bill 2813, which was modeled after the bill in Florida, and then the Empowering Families in Education bill for Pennsylvania, which would require notification for parents on these topics when they're being discussed with their children. And there's a lot of research that shows that all this attention can negatively affect the mental and physical health of young people. A lot of research and experts find that when a child's identity becomes politicized and a point of debate, it can be dehumanizing, it can increase stigma and stress, and be especially damaging for, young, developing, impressionable minds. And then we know that increased stress also leads to poor academic performance and to substance and tobacco use. Next slide. So I've been pretty in tune to a lot of the local discussions about these issues at school board meetings throughout Pennsylvania, and thought some qualitative data and quotes from students could best demonstrate the impact these policies are having. So LGBTQ students have been very brave in advocating for themselves and sharing what they believe would be best for them and their peers. And these quotes are pulled from public recordings of school board meetings when students provided public comment in opposition to some of the policies that I just discussed. So I'm going to read through them just because I think they're pretty powerful and they're from the student perspective. So the first one, trans youth have to deal with feelings of internalized transphobia, bullying, discrimination, harassment, and many more issues, while also now having to deal with our education system ignoring our existence. It took me a very long time to embrace my identity, and I know that path to acceptance would have been so much easier if I had representation. When someone spends their entire life trying to figure out where they belong and have been told that they cannot be the person they feel that they are, words are crucial for them. Think of your students in school who only have school as their glimmering hope of equal treatment in society as an LGBTQ+ individual, and who do not receive the support they deserve at home. Everything feels way less safe. They are trying to hide us in a way. They don't want any LGBTQ representation anywhere. So like the previous collision, these are very complex and distressing emotions from young people who are simply trying to go to school. So next slide, please. The next collision is social isolation, largely stemming from the COVID-19 pandemic disruptions and consequences related to school closures, social isolation, economic hardship, and family loss, but also from a lot of recent policies prohibiting youth attendance at various locations. Again, I have some news clippings from Pennsylvania calling attention to this issue. And this is really an emerging issue of youth being prevented from many public places. So now that the pandemic rules have loosened, a lot of youth still have no place to go and hang out and be social with friends in Pennsylvania. There are a lot of places that have instituted these curfews for young people. In Philadelphia, I was reading about how there are many signs that discourage backpacks or shopping in groups and things that are associated with being young. And all these policies send the message to kids that they are not welcome. And we know that the pandemic was hard on all children, but it was especially hard on queer kids. A survey from the Trevor Project found that more than 80% of teenagers who say they are queer reported that COVID-19 pandemic made their living situations more stressful. And only a third said their home is understanding and affirming of their sexual orientation and or gender identity and a safe space for them to spend their time. So we can really see that the widespread remote schooling during the past few years really disconnected queer students from supportive adults, peer groups, and services. Next slide. And then other findings here from the CDC Youth Risk Behavior Survey kind of reiterate those same findings from the Trevor Project survey. These queer high students were 4 times more likely to attempt suicide than their heterosexual peers during the pandemic. 20% of queer students said they had been physically abused by a parent or other adult in their home while in isolation due to the pandemic. And then over half of queer youth reported that their mental health was poor most of the time or always due to the COVID-19 pandemic. And again, this is a new and emerging issue and something previous generations of youth have not had to deal with. Next slide. The next collision is healthcare. There are great disparities for LGBTQ youth regarding access to healthcare services, and there is very little research on sexual health related to protective factors for queer youth. But most emerging, and one of the new collisions adding to the growing complexity of our intersection analogy, is the growing attempt at prohibiting gender-affirming medical care. So far, since 2020, 36 states have attempted to restrict access to this type of care through legislative action. And there's a large body of evidence that shows that research that shows that gender-affirming care improves mental health and overall well-being for these youth. And it specifically lowers the odds of depression. And then other research shows that youth without access to this type of care are associated with increased suicidality. So the impact, is not to be dismissed. It is large. And the Williams Institute out of UCLA actually estimates that about 150,000 transgender youth live in these 30+ states where access to gender-affirming care has been restricted or is at risk of being banned due to legislation. And an interesting finding from that Trevor Project survey was that they asked in their survey, and they found that 93% of transgender youth worry about access to gender-affirming care on a regular basis. So that's 9 out of 10, and that's certainly an unfair burden to carry when the research is very clear on its benefit. Next slide. And then this next slide just shows the increase in legislation over the past year targeting queer Americans. This accounts for all bills, but the majority of these are healthcare related. So I just wanted to demonstrate how this was an emerging collision within our analogy, what this looks like in a visual way. So you can see the increasing burden and how, again, previous generations of high school students within the most recent years have not had to contend with this stress. Next slide. And then the last emerging collision I wanted to discuss with you is youth violence. We are all well aware of the increased level of gun violence and shootings in schools that's happening in communities. In 2022, there were the most school shootings with injuries or deaths ever reported. And this is a local issue as well. In Philadelphia, the number of shooting victims under the age of 18 has steadily grown since 2015, and the percentage of young people arrested for gun violence tripled between 2017 and 2022. And then in Allegheny County, there was some really interesting research done by Ceasefire PA and the Greater Pittsburgh Coalition Against Violence. And they found that youth are regularly concerned about this issue. Over half have lost a family member to gun violence. Almost half have personally witnessed gun violence, and around 90% are concerned that gun violence will impact them and their family's health and safety. And then I think what's important, and will relate to my conclusions a little bit later in the presentation, is that 84% in that survey felt that nothing at all or only a little was being done to address this issue. And then relating it back to queer youth, we know that research indicates queer youth are much more likely to be victims of violence than the general population. So they're more likely to be victims of sexual violence, assault, stalking, dating violence, parental abuse, and all the consequences are heightened when weapons are involved. Next slide. So this is heavy, and it's a lot of issues that youth are facing right now, and so much so that the Human Rights Campaign, for the first time ever, issued this national state of emergency for LGBTQ plus Americans. And I cited research earlier that stated when your identity is polarized and a topic of debate, it worsens mental health outcomes. So we can just kind of hypothesize the impact that this warning is having on children for the country that they live in. Next slide. And then I think this quote from State Representative Zoe Zephyr really sums up the impact of everything I just discussed. So she mentioned in a recent interview that they are banning our past when they ban our art forms and our histories. They are banning our present by banning teachings about us, and they are banning our future when they ban our healthcare. Next slide. And so really, we need all hands on deck for queer youth. And I hope that this is kind of the case that I am making. And as public health practitioners, it's kind of our obligation to help improve the physical and mental health of this vulnerable group. We really need to consider these new intersections when designing tobacco prevention and control programs and conducting our research. Next slide. Because if we think about the disparities facing queer kids before, they're even worse now with all these emerging intersections because they're all just so new. And the most recent findings from the CDC Youth Risk Behavior Survey found that all indicators of poor mental health and suicidal thoughts and behaviors increased from 2011 to 2021. So the quote at the bottom just kind of says that they're calling for urgent interventions because this is a bit of a crisis. And then this slide, you can take a look, just kind of like highlight some of the disparities overall. This isn't pandemic related, which I mentioned earlier. So I talked about specific disparities related to violence, pandemic, healthcare, but we're seeing this translate to overall indicators of health. And I think one of the most serious ones here is that nearly half of LGBTQ+ students seriously considered attempting suicide during the past year. So over half. Next slide. So why all the talk about mental health and how does this relate to tobacco and nicotine use? Well, if you recall, as I said in the beginning, that nearly 90% of adult daily smokers start tobacco before the age of 18. So we need to look at why teenagers are starting tobacco. And I know that we are, and the research is telling us that a majority are starting tobacco to decrease stress, anxiety, or depression. Research from the Truth Initiative found that over 80% of those who had used e-cigarettes or other nicotine products said that they started vaping to decrease stress, anxiety, or depression. And then more than half of vapers use e-cigarettes to continuously cope with life's daily stressors, saying that they need to vape in response to stressful situations or anxiety triggers. And then in a separate study, youth were also asked about the advantages of nicotine use and kind of like what they see as its benefit. And the most frequently listed advantages were relaxation, stress relief, and social connection, which is interesting and which we could potentially relate back to our discussions about the feelings of social isolation. Next slide. And then Ashley kind of mentioned this in the introduction, but since LGBTQ youth are so stressed, this is manifesting in using tobacco products at much higher rates and using tobacco products more heavily than their cisgender and or straight counterparts. So I won't talk through these, but we can just see that these graphs show some of the disparities. On the left is LGBT females, and on the right is transgender youth. And we can see the differences in use pretty clearly. Next slide. So anxiety and stress relief from tobacco products is not true, and youth aren't actually getting that relief, which I'll get to in a moment. But really, how did this belief and opinion come to be? Well, the tobacco industry has been pushing this narrative of mental health improvements for a while. In many of their advertisements, they feature themes of stress relief and relaxation. You know, think by the pool, relaxing with friends, on the beach. We've all seen those images of the advertisements. And something interesting I found in my research for this presentation were some ads for vaping about getting relief from Zoom fatigue or online classes. So the industry is always adapting. And then there are ads placed in fun atmospheres like music festivals and bars where young people are going to de-stress and unwind. So we begin to associate the products with that feeling. And then another tactic the tobacco industry has used is kind of marketing their products as a way to recover or self-medicate from other substance use. So they've actually sponsored research trying to prove this and distributed their products to mental health facilities so they could be used by those facilities' clients. Next slide. Now, there is a sense of relief when using a nicotine product. I don't want to dismiss a feeling that is there, but it's kind of a false sense of relief that's tied to the cycle of nicotine withdrawal. I can walk you through this diagram that demonstrates what that is. So if we start with an anxious teenager, and then at the top, they use nicotine to hopefully get some relief because it's what they believe, but really it just worsens their anxiety and depression through an actual physical response. So there's an increased heart rate and blood pressure, labored breathing, tense muscles, dopamine drops, and decreased levels of oxygen. All of those things are happening in the body. And then the teenager keeps using because they don't know why their symptoms are worsening. And then this leads to a nicotine addiction. So then whenever they stop using the product, they'll go into withdrawal, which is only relieved by using nicotine again. And this is what provides that false sense of relief and that false sense of anxiety, depression relief. So hopefully we can break the cycle and educate youth on where those feelings actually originate. Next slide. And that's because we know that real mental health benefits come from quitting tobacco and nicotine products. And there's overwhelming research that tells us that. So quitting tobacco lowers levels of anxiety, depression, and stress, improves mood and quality of life. It actually helps teens feel more control over their lives. And research even shows that it could improve self-esteem. And then there's even this study cited that the beneficial effect of stopping smoking on symptoms of anxiety and depression could equal that of taking antidepressants. But what is troubling is that young people don't know this. And over half of vape users from a Truth Initiative survey do not know that vaping is increasing their anxiety and irritability. So we really need to close this knowledge gap. Next slide, please. So what can we do? Well, of course, we can continue the important work happening in Pennsylvania right now, like efforts to restrict flavored tobacco products and tobacco product advertisements, which will help prevent youth initiation and the association of tobacco with mental health benefits, as well as our Quitline, which is amazing and provides unprecedented access to cessation services. But then on top of that, kind of doing this all hands on deck approach for queer youth, we need to make sure we are prioritizing these emerging issues in our research and our evaluation projects. We really need to learn more about some of the protective factors against all these issues because they are so new and they are all converging at once on top of the traditional stressors that teenagers and then a queer identity puts in someone's life. And then I know sometimes in public health, we like to stay in our lanes and our departments, but I encourage cross collaboration, especially with mental health departments and services and programs. You can make sure that you're advocating for supportive mental health policies in schools and healthcare settings, because when you improve mental health outcomes, you improve tobacco outcomes. And there's actually research also that shows that when you improve outcomes for queer students, the outcomes for all students, health outcomes improve. And then we can also just make sure that we're addressing the converging mental health and vaping crises head on. And I know that we can't fix climate change. I know that we can't stop gun violence. These issues are very, very complex. I mean, individually, and we can't do that. And I know that we are still figuring out how to handle a lot of this as adults. I know, as a gay man, it's not easy, but all that is to say, don't underestimate the power of your words. I think we can show that we are acknowledging these crises and not being dismissive, even if we're not fixing them. So some of the stats that I presented earlier tell us that youth largely think the government, adults, and others in charge are just being dismissive and not doing enough to solve some of these emerging issues. So we can just use our words and just to make sure that we are acknowledging and we're working on those things. And so we can also think about integrating this with tobacco cessation programs and going about it in this whole child approach. If you're conducting a tobacco screening questionnaire, maybe you can ask more questions about some of the reasons why they're using or started using tobacco, and ask how some of these issues are affecting them, what's happening outside of their life and outside of their tobacco usage. So you can potentially refer to other services or resources that are a bit more specific and maybe could also help improve your tobacco outcomes that you're looking for. And then if you're conducting a cessation class or a program with youth, consider integrating it with school-based mental health services and or providing the school counselor in the program as a resource or a co-facilitator. You could also merge with existing efforts such as the social emotional learning, which is happening in schools a lot, and suicide prevention programs or the suicide hotlines or the Trevor Project hotline even to build momentum. And then consider things like safety. You can ask yourself kind of like, where am I holding this program? Is it considered a safe space? Can youth access the site safely? Is the facilitator considered a safe and trusting adult? Maybe your tobacco cessation class can be held where the school's Gay Straight Alliance is held, so it's a comfortable place, or the school's library. And we can ask youth and empower them to kind of like help design the best program to meet their needs. From the LGBTQ Health Needs Assessment in Pennsylvania, Christina is going to present some of the findings after this, but in one of the questions, respondents who currently use tobacco and were interested in quitting, one of the top places that they felt most comfortable for receiving cessation services was attending a cessation class at an LGBTQ specific organization. So we can make sure that we are creating this safe space and just kind of like thinking about the programs that affect the whole child. And tobacco cessation just can't kind of like happen in a silo because there's just so much going on in a young adult's life. And these programs just kind of like really need to reflect that and help these kids navigate this complex intersection that's happening in their lives right now. So that is all I have. Thank you, everyone. Next slide. It's just time for questions, I think.
Thank you, Brian. I'm going to present briefly on the data, and then we will be able to go into the Q&A. I'm just going to quickly make sure that the chat and Q&A are enabled, as I'm sure many of us have become very familiar. Zoom does not always work the way you think it's going to. So give me just a moment to check that, and then we will move into the presentation of the data. I apologize, everyone. It looks like maybe the chat was not enabled, but it should be accessible now. And after I present the data and introduce our moderator, we will move into a Q&A session. Well, thank you everyone for joining us for the final session in this series. For those who have not joined us before, I am Christina Graham. I use she, her pronouns, and I'm the Data and Evaluation Manager at Bradbury-Sullivan LGBT Community Center. Thank you, Brian, so much for presenting. I want to acknowledge Brian's work on the Health Needs Assessment Project, both the assessment survey and the report. I can't think of anyone better to share their work in this area with us today. So thank you for being here. Some background on the assessment for those who have not joined us before. The Pennsylvania LGBTQ Health Needs Assessment is a biennial survey that was first piloted in 2015 and 2016, and we had our first statewide administration in 2018. So now we've collected statewide data in 2018, 2020, and 2022. It is the 2022 data I'll be presenting today. The assessment collects data on LGBTQ Pennsylvanians' experiences with a variety of health and wellness issues, including their experiences with healthcare providers, mental health experiences, including accessing mental health care, substance use, tobacco use, cancer incidents and preventive screenings, sexual health, financial security, food insecurity, and so much more. The assessment is funded by the Pennsylvania Department of Health and administered with the Bradbury-Sullivan Center and Public Health Management Corporation. Findings from the assessment are then made available to a wide variety of folks who use them in many different ways. And that includes researchers, both in the academic sphere and in public health, healthcare providers, government agencies. But most importantly and most critically, the data also goes back into the hands of the LGBTQ community. We collect the responses for the survey through a data collection coalition of more than 40 different organizations throughout the state, primarily LGBTQ community-based organizations, but also some healthcare clinics that specialize in gender-affirming care and some other nonprofits. And those data collection coalition members then also make use of the data when the findings are available. The responses for 2022 were collected from January through March of last year, with 4,228 responses included in our final data set. Some things I want to highlight about the 2022 survey. We had improved coordination in our use of promotional materials. Thank you so much to the communications department at Bradbury-Sullivan, who thought really critically about creating inviting and inclusive materials that we could share with the Data Collection Coalition to promote the survey. Our collection partners also received weekly updates via email and phone call that included things like tips for promotion, information about how promotion was going in their local area, and ideas on what they could do to direct promotion to get us the responses we need. And that included targeted promotion for youth, older adults, Black, Indigenous, and persons of color, Asian American and Pacific Islander community members, as well as our Spanish-speaking community members. And we had improved outreach in Spanish compared to previous years, with more materials, as well as dedicated partners who regularly communicate and conduct programming in Spanish, who were able to share the survey with their community. And that really allows us to collect data throughout the state. Bradbury-Sullivan is located in the greater Lehigh Valley in Allentown, Pennsylvania, with two members of our team being located at satellite sites in Philadelphia and Pittsburgh. But we certainly wouldn't be able to reach so much of the state without that data collection coalition and being able to do specific outreach to subsections of our community, such as older adults and youth, and really relying on other centers that do specific programming and know that they could make inroads with community, being able to share their usage of the survey in the past, as well as being able to share that, hey, they've taken it themselves. And we think that that makes a critical difference in people feeling like this is something that is accessible and something that they want to be a part of. Some updates to the survey tool that we made for 2022. I included a new option in our demographic questions that folks were able to identify as Middle Eastern North African, in addition to a range of demographic options that we had used in the past. We also always consider adding new health topics. For 2022, that included COVID. We collected the 2020 data in the midst of that initial lockdown. So the survey tool had been created before COVID-19 was an emerging threat. So we were able to ask new questions about COVID-19 vaccination in our 2022 survey. We also added new questions on neurodivergence and disability, giving community members the ability to self-identify as having that experience. There was also some new questions about sleep quality. But let's dive in to our data on tobacco use. From the 2022 assessment, we found that 67.4% of all respondents to the assessment had ever used at least one type of tobacco product at some point in their lives. And that included a variety of products such as cigarettes, e-cigarettes or other vaping devices, cigars or cigarillos, hookahs, smokeless tobacco of various varieties. This does vary by lots of different factors, including age, race and ethnicity, and geographic region. For example, we found that about 3 in 4 of both Asian American and BIPOC community members had used tobacco products at some point in their lives, compared to about 65% of white non-Hispanic LGBTQ plus Pennsylvanians. A lower usage rate among our younger adults compared to older, likely due to the fact that this was asking, have you ever used it at any point in your life, with our older adults having more life years to have used tobacco products. Just as Brian really focused on some of our emerging issues with youth, I really want to highlight some of what we found about e-cigarette use, as this is an emerging health threat still that we are not quite sure how to combat in the same way that we've combated traditional combustible cigarettes. We asked our respondents if they currently vaped some or every day out of those who had ever tried e-cigarettes. So about 1 in 3 respondents had ever tried e-cigarettes or other vaping products. And at the time of taking the survey, 28.2% of those were still using those products at least some of the time. For young LGBTQ plus Pennsylvanians, those under 25, 37.8 are still current users, likely meaning that they don't have the resources they need for cessation. Continuing usage rates were also high among our Asian American community members, BIPOC community members. And I really want those who work in the tobacco cessation field to think critically about how they're providing resources to these communities, whether it's LGBTQ plus folks, just Asian American identified community members, or the intersection, because these are communities, both BIPOC, Asian American, and Indigenous communities, that tobacco has historically targeted, along with the LGBTQ plus population. And so for those folks sitting in the intersection, for example, our young folks who are queer and might also be part of one of these racial or ethnic groups, they are compounded by the way that big tobacco has targeted them. Something that I think is encouraging is that our respondents really felt that vaping is a health threat to the LGBTQ community, with our young respondents recognizing this really strongly. 60% of those 24 years and younger felt that vaping, juuling, and e-cigarettes are a health threat to LGBTQ communities. Those that agreed with this statement was about 41% overall. But we also saw really high agreement among Asian community members, BIPOC community members, and transgender and non-binary community members, with over half of transgender and non-binary respondents agreeing that vaping is a health threat. I wanted to highlight these communities as they are some that are most likely to use these products, and yet we also see strong recognition that they are unsafe for our community. So I think understanding that it is not just individual choices that lead to folks accessing these products, but many of the factors, those collisions that Ryan mentioned, targeting by big tobacco, and the lack of affirming resources. I was so glad that Brian mentioned the PA Free Quitline as a really incredible free resource that is available to Pennsylvanians. However, we found that knowledge of the Quitline is fairly low, with just about 1 in 3 of all participants in the survey having awareness of the PA Free Quitline. If you are in a position to promote the Quitline, especially to LGBTQ Pennsylvanians, I encourage you to do so. The Division of Tobacco Prevention and Control has some really great materials, including ones that we've helped develop, that can be shared. I want to call out many of the Pride festivals throughout the state, including ones that have been happening in the past few weeks, that have been able to promote the Quitline in their materials, whether having info at booths or in promotion for the event. I think it's a really unique way that in a time that we're coming together to celebrate, as Ashley said, queer joy, to be able to share resources with the community. And in that way, acknowledging that these are safe and affirming resources that our community members can access. Especially because we know that the LGBTQ community in Pennsylvania does have interest in tobacco cessation. We found that among those who were current tobacco users, 41.3% were looking to quit within the next 12 months at the time they took the survey, and an additional 18.4% were looking to quit in a timeline greater than 1 year. And preferred resources for accessing cessation information included healthcare organizations, local LGBTQ+ organizations, as well as text line services. However, 41.5% did not know where they would prefer to receive cessation resources, even if they were interested in quitting. And I think being able to provide that information, closing that knowledge gap, and sharing local affirming resources is critical to allowing LGBTQ+ Pennsylvanians who are tobacco users to cease or reduce their tobacco usage. We did find that 2 in 5 were not interested in tobacco cessation at the time of the survey. And I want us to think about what are the factors that may be that someone is not yet interested in tobacco cessation. And although someone may not yet be interested in cessation, they may still be interested in resources, information about health effects, or about reducing their usage. Something really great that we have found through each iteration of the Pennsylvania LGBTQ Health Needs Assessment is support for tobacco-free spaces, where our community can be free of the influence of the tobacco industry and also with reduced social pressure to participate in tobacco consumption. Nearly half of all respondents support tobacco-free prides. I will note that quite a few folks are neutral on these topics. I think presenting an opportunity to plead our case about why tobacco-free and clean air spaces can be beneficial for all members of our community, including those who may identify as disabled or neurodivergent. Having those new questions in the survey has really allowed us to explore some of our data in new ways and understand how we can best support the most vulnerable members of our community. And again, I want to reiterate that providing tobacco-free spaces at Pride celebrations really can make these events more accessible to more members of our community, and that educating people on the influence of the tobacco industry through the use of things like advertising, sponsorship, and free products is really critical. Messaging that we've been using at our organization recently is that every march begins with a single step. For every new event that creates a clean air space or goes tobacco-free entirely, or that rejects industry sponsorship, creates safer celebratory spaces for our community. And when Pride celebrations in Pennsylvania become smoker tobacco free, that part is the most critical piece, directly rejecting tobacco industry sponsorship. And it creates these safer spaces, and it prohibits big tobacco from being part of that day, being in place in the venue. And that can also mean the entire space is free, only using venues that don't allow smoking, or as I said, establishing specific usage areas for specific clean air spaces. And it's a really key opportunity to connect community members with affirming resources in their area. And that's also true for a variety of health topics that we've talked about throughout this series, whether it be mental health resources, combating social determinants of health, or other community supports. We also saw strong support that LGBTQ bars should be smoke and tobacco free, as well as casinos. I want to highlight recommendations from the full report, and please please take a look at the full report. It's quite long. It is full of so much interesting information. And if you've not been able to attend the other events in the series, the recordings are available on our website as well as the PDF of the report. But the recommendations that I wanted to highlight here are about supporting initiatives that address the social determinants of health. We've talked about that a lot in this series, and I think it's something that we need to continue to bring to the forefront. Promoting tobacco cessation opportunities, whether that's if you're in a position to provide funding, resources, or supplies to an organization that can host cessation spaces within their community, finding those spaces that the community already considers safe, affirming, and welcoming, and at times celebratory, like Pride, and using them as a venue to share what you have. Bolstering community supports for Black, Indigenous, and people of color. Again, due to the intersectional lives that these folks lead, they've really been disgustingly targeted by big tobacco. And like I said, for those who are, say, young, Black, and queer, this is only compounded, and they are lacking resources to help them live safe and affirming lives. And as always, partner with your local LGBT community-based organizations. They really have the boots on the ground knowledge of what their community members are experiencing in the day-to-day and how best to help them. As Brian suggested, actually communicating with youth to build affirming programs for them, that goes for the community at large. And your local community-based organizations are truly the experts in that area. I encourage you to read the full recommendations on pages 53 through 55 of the full report. There's really fantastic information in there on how the health needs assessment can be used to support Pennsylvania's LGBTQ community. The full report can be accessed at that QR code or at that bit.ly. And again, thanks to PHMC and the Pennsylvania Department of Health. Before we dive into the Q&A, I first want to introduce our moderator. If you've joined us for other events in this series, you've seen this as an opportunity to highlight some really incredible activists here in Pennsylvania, as well as community-based organizations that help make the health needs assessment possible. I'd like to introduce Tesla Taliaferro. Tesla is an active and dedicated LGBTQIA+ advocate and an openly transgender, gender fluid, queer, and polyamorous person. They currently serve as the president of the Rainbow Rose Center Board and have previously served as the secretary of PFLAG York and is the former chair of the Social Justice Committee of the Unitarian Universalist Congregation of York. He is an award-winning contributor for the Central Voice, Central PA's LGBTQ+ news source. They currently live in Harrisburg with his nesting partner and in close proximity to another partner and their many menagerie of pets. I also want to take this opportunity to thank Tesla and Rainbow Rose for their dedication to the Health Needs Assessment Project. You've been a part of the Data Collection Coalition quite a few times, and I have seen Rainbow Rose widely utilize the assessment's findings to support your programming. It's really great to have you here to moderate the Q&A and to share your expertise. Tesla's going to share a little bit about their work, and then we will move into the Q&A. Thank you for being here.
And thank you, Christina, for having me. Good afternoon, everyone. As Christina mentioned, my name is Tesla Taliaferro. I use he, they pronouns, and I'm the volunteer board president for the Rainbow Rose Center, which serves York County, Pennsylvania's LGBTQIA+ community. Our organization fosters an environment of inclusion, equity, and health where all LGBTQIA+ community members thrive in York County, Pennsylvania. We really envision an inclusive community where all York County individuals feel safe and welcome in their everyday lives. And to do that, part of what we do is promote the health and well-being of the community, including how we can live longer and live prouder by being tobacco-free. To do that, not only do we run tobacco-free events such as York County Pride, which had over 3,000 attendees this year for our second annual event, We have helped connect over a dozen community members interested in cessation with the resources that they need to quit, and have recently recruited 79 teenagers to the Tobacco Resistance Unit, or TRUE, program this year alone. I would like to thank the Bradbury-Sullivan LGBTQ Community Center for helping the Rainbow Rose Center establish our tobacco-free organization, and for organizing the PA LGBTQ Health Needs Assessment Survey, as well as for allowing us to be part of the conversation today. So let's go ahead and take a look at the chat and see if there's any questions.
And I apologize that the chat was not enabled, but it should be accessible now.
I know I saw one attendee had their hand up from the very beginning. Someone just asked how to contact people. Is there someone in particular you want to be able to contact? Perhaps Brian Zepka or Christina Graham? Okay, yeah, so you can get in contact with the Rainbow Rose Center in York County at info@rainbowrose, like the flower, center.org, and I'll also put it in the chat.
I'm also going to drop my email in the chat. And I wanted to share that for the data from the survey, as well as the findings, are accessible to folks even who are not members of the Data Collection Coalition. So if that is something you are interested in, please reach out to me and I will either be able to provide it to you myself, or I will connect you with the appropriate resources at PHMC. I'm always really interested in to hear how folks are utilizing the findings to support their own work.
Now, we previously came up with some questions. I'm going to ask one of those while we see if any more questions come in the chat. What are some of the ways that healthcare and treatment providers can create affirming environments for LGBTQ+ people seeking tobacco cessation or reduction?
I'll take a first stab at that. As I mentioned in my presentation, I think connecting with your local community-based organizations can be one of the first ways you can sort of do a pulse check on whether your programming is affirming and appropriate, especially since the needs of your community, might vary. The LGBT community is not a monolith, so accessing your local resources can be critical. I would also say that that's also a key opportunity to be able to provide funding and resources to local community-based organizations. We do have an education institute here at Bradbury-Sullivan that provides both fee-for-service and grant-funded trainings. I would say that folks here in this room are already, doing one of the things that I think is critical, is seeking out resources, whether they be presentations, webinars, information shared by local or national nonprofits that can further your learning, whether it's presentations like this where CEUs are available, if that is something that would benefit you, or other presentations that may just share whether even basic information on how to be an affirming healthcare provider. I'd also say take a critical look at the information you're asking from folks if you're a healthcare provider. Perhaps contact a local organization or Bradbury-Sullivan to review the kind of forms you're asking, because we often see language that is not gender neutral or is overly specific without need. And so really asking, do I even need this information from participants to be able to provide them this service can also be critical. Brian, did you have any suggestions?
I would certainly echo all of that. That's great advice. And then I think from the youth perspective, I would say just like take a look at the environment that you've created. I know a lot of youth kind of like walk into this place and, as a queer person, you're kind of judging, is this a safe, trusting place? Like looking around, and I think just adding some cues and, it could be posters, it could be classes that are offered, like a schedule of LGBTQ plus inclusive programming. So I think just like going out of your way to make sure it's clear that this is an affirming and safe place is great. And then, yeah, and I definitely agree with the questions being asked, and I would encourage training on interacting with LGBTQ plus patients or class participants. There's definitely some things that could happen unintentionally, like stigmatizing with certain questions or certain discussions around different health conditions. So definitely training to make sure that you are learning, if you're a healthcare provider, the best way to kind of like interact with your queer patients.
As an organization that has started doing affirming work, whether it's referring people to services or youth education, Tesla, is there lessons learned from your work at Rainbow Rose?
Yeah, we've definitely had some grant opportunities granted to us through our local health organization, WellSpan Health, to help promote tobacco cessation and tobacco resistance, which has certainly helped our organization get started from a grassroots organization to where we're at now and serving the much larger York County community. So I do think there's opportunities to also, when you're engaging with your local LGBT centers, invite them to your advisory boards. Have those deep conversations about how to better serve your clients and your patients. And I think those are some of the better ways that you can help make a safer area and safer environment for the LGBTQ community when it comes to working and engaging with your company or your health organization. Not currently seeing any other questions in the chat. So another one that has come up. Oh, here's one. What ideas can you share regarding engaging more youth in data collection efforts? That's a great question. Brian, you do a lot with youth. Do you want to take that one on first?
Yeah, give me a minute to think.
It's hard. I think one of the things is sometimes doing youth education as well as recruiting for the health needs assessment, I discover how woefully out of touch I am, even as a young professional. I'm not on TikTok. I'm not going to be on TikTok. So I don't really know what the youth are into. So I think having members of a team, whether it's students or interns, can perhaps be a step that we take in a health needs assessment in the future to better engage youth. I think finding and funding partners throughout the state who are doing youth work in the day-to-day, that are seeing youth in their buildings, in their programmings, is probably my other best suggestion. Is they've already got them there. And so being able to provide them, whether it's the promotional resources, as well as some funding to cover their staff time and what other needs they have, that is one of the ways that we can continue that. And that worked really well for some other parts of our population, as we had more older adults in the sample than ever before, which was really exciting. And I think so maybe replicating that in the future, finding partners that say, yes, I am absolutely certain I can get youth to take this survey. They're already here. They're already interested in advocating for their health. And I find that LGBTQ youth are particularly advocacy minded, which works for both engagement in the survey as well as tobacco cessation, educating them on the ways that they have been targeted, on how contributing to projects like this can directly benefit them. And I also think that I'm going to put a plug in for an interesting overlap between your collision of climate impact and tobacco cessation. I find that youth are really interested in hearing about the impact of e-cigarettes and e-waste on the planet, and that tying in what's really interesting and important to them, so that you can share why a project matters. So I hope that we will be collecting data again in 2024, that perhaps we can really engage some of our partners throughout the state. And in that way, both engaging youth in the project and providing critical funding to the organizations that serve them. Brian, did you have time to think?
Yeah, that's a great answer. I mean, I immediately thought of going to where the youth are as like the default. I was trying to think of something else, something new. But I mean, what's tried and true works, certainly going to the schools where they are. I do think youth get more engaged when other youth are involved. So if you're kind of a group of adult researchers and you want to conduct interviews with youth, you can maybe make it a focus group or do multiple interviews at once. So other youth are there with them. And then this is anecdotal evidence, just kind of like what I've been hearing, but when you're setting up maybe a new research project and your data collection efforts, I know not everything can be in person, and there does have to be some online surveys conducted, but I've been hearing and reading about some pushback to virtual from younger kids and students. They're kind of tired of Zoom. They're kind of tired of doing everything virtually, and they're looking for in-person interaction. And so I know we've kind of all gotten comfortable with Zoom now, and we can do Zoom focus groups and Zoom interviews, but maybe if the opportunity and the capacity is there to do it in person, it could definitely help with engagement with youth specifically, because I do hear that there is a lot of Zoom and virtual fatigue. So
yeah, and I just want to add to that. I think it helps also to bring in local influencers, especially drag performers that the kids are really engaged with or who they follow. And that includes TikTok influencers as well. We know that the big tobacco industry has often used the drag community and other social media influencers to promote their tobacco products. And I think we need to push back against that, especially when we know that the youth are engaged with those folks. And just echoing what Brian said, going to the students where they are, going into the schools and working with the local gender and sexuality alliances or gay straight alliances, and even with your local libraries that have programs for the LGBTQIA plus youth. There's plenty of opportunities there. And Shakina also mentioned like using QR codes. That can help because a lot of those kids are very adept in using technology, and using QR codes has definitely helped. We have another question. Was there anything in the 2022 health needs assessment that you found surprising? And are there any new components that will be added to the 2024 assessment?
I don't know that I was surprised by what I'm going to say, but I was perhaps delighted is the word. Although Brian is someone who's spent quite a lot of time looking at the data. Did anything immediately come to mind for you before I share what I'm thinking of?
share yours. I'm curious now.
So we had more than 4,000 respondents to the survey, 4,228. And if I'm remembering this correctly, and anyone who works on the project can stop me if I'm wrong, but less than 160 of them were not vaccinated against COVID-19. The vaccination rates were superb. And although that did fit with what we saw sort of in person through the vaccination events we held here at the center, through what I was hearing on social media from other organizations like the Tegan and Sarah Foundation, from Kaiser Permanente, from the CDC, that LGBT community members were accessing vaccination at really fantastic rates once it was available to the general public. But to have the data for Pennsylvania was just really nice. And it really was confirmation of what we saw in person, of people, the way that the community spoke about receiving vaccination. I think that the history of the way that the LGBT community has weathered other public health crises, including the HIV/AIDS epidemic. That was very present for folks. The altruism was strong in the LGBTQ community in the way that it wasn't necessarily seen in other communities. So to have the numbers then to back up what we were seeing in real time was just really nice. I don't know that I would have known that it was going to be quite that complete. I knew it was going to be good, but that was just, it was a really nice moment to pull that piece and to put it in the report and to have been able to share it in the time since we've put the report out.
Yeah, I think for me, and this was kind of what influenced my presentation a bit and just from this assessment and other findings from different organizations and things throughout the past couple of years is, the mental health findings really always strike me, and how high, or I guess depending on how you look it up, how poor the outcomes are. I think it was like 9 out of 10 of the younger respondents had a challenge. Mental health.
It is 9 out of 10.
And then some of the other presentation statistics that I presented, with those more than half contemplating suicide, those numbers are so high. And I think it's just really is calling for attention that's not really being delivered at the national scale. So that always strikes me. And then also something else, this I always find interesting. But also when I was at PHMC, a lot of the oral health care, but the gaps in like dental care, I always find very interesting. And I wonder why that is. And because I think it was like half haven't visited the dentist in the past year. And so that's always just something that I find very interesting.
I'm excited to say that we've had folks at the PA Oral Health Coalition, as well as some other folks who work in that area here in the Pennsylvania, have been utilizing that data. And one of the ideas that they brought up, although we haven't been able to quite bring it to fruition yet, is connecting affirming providers with prides and maybe getting free, whether it's oral cancer screenings, because that's also a great opportunity to talk to folks about tobacco cessation, free cleanings, or even free dental supplies, like free toothbrushes and toothpaste at Pride, and at least getting people connected with folks in the area. Oh, Paula, you will be at Meadvale Pride and Erie. I'm glad that that was able to work out. Really exciting. I know that Erie has been connected with a lot of really great health resources. There are so many Prides still coming up throughout the state. Pride toothbrushes. And Warren, sorry, I'm so excited by this information because we did see lower rates of dental care access than I think folks would like to see. Pennsylvania is so interesting in that it is so rural in so many places, and I know that that's a factor in accessing dental care. I'm excited to see that maybe that's something we can bring throughout the state, not just Western PA next year. I'd love to see Pride toothbrushes at every festival next year, not just Quitline resources. That'd be really fun.
Nice.
All right, we are drawing to our close. We probably have time for one more question.
Not seen any more questions come through, but we can wait another second and see if any come through. And then if not, we have a couple other ones.
And I would invite folks to dump in the chat if you are someone working this area. So thank you, Paula, for chiming in, and you want to share an upcoming event, a place to find resources, a recent success in your work, please share it. There's, as Ashley said, Pride is not just June. For so many of us, it is a 365 endeavor. Yes, there's lots of really great events happening this month or have happened so far, and our team has certainly really been enjoying them, but there's still so much to come. For those who can make it to Lehigh Valley Pride in August, we would love to see you there. It is our 30th year of Pride here in the Lehigh Valley. And our team is also going to be at a number of other events throughout the next few months. as well as just other community-based events throughout the year. So not just Prides, but events at our center, as well as just throughout the area. And I know that other teams throughout the state operate much in the same way. So definitely connect with your local center, find out how you can support them, what resources they need, and how you can get involved if that's something that you're interested in, whether as an individual, as a professional, or on an organizational level. And with that, since I don't see any more questions, I would like to introduce Kayla McGarry from the Philadelphia Department of Public Health. And a thank you to both the Philadelphia Department of Public Health and Health Promotion Council for making this series possible. And Kayla is going to close us out, and thank you all for being here.
Awesome. Thank you, Christina. Hi, everyone. Thank you so much for holding this space. I'm so happy to be here. Thank you so much to all of the panelists, Brian and Christina. Thank you for sharing your expertise and valuable information. This series has provided a space to build understanding and avenues to build support that builds change. Like Christina said, my name is Kayla McGarry. I use she, her pronouns, and I am the Tobacco Special Projects Coordinator with the Philadelphia Department of Public Health in the Division of Chronic Disease and Injury Prevention. I appreciate the opportunity to echo all of what was discussed today. We at PDPH understand the deep roots of tobacco use across communities and the continued pressure from vaping. We also understand that historically the LGBTQ+ community has been targeted by marketing from the tobacco industry, resulting in higher tobacco use rates. We work in support of tobacco treatment, helping Philadelphians who use tobacco products quit, raising awareness for the effects of treatment, and helping Philadelphians who use tobacco products, oh, sorry, I've got all mixed up, using policy and media to change the norm, promoting the PA Quitline, and working closely with community partners to support groups who are disproportionately affected by tobacco use, such as low income, unhoused, youth, LGBTQIA, BIPOC, people with mental health and substance use disorders. And we also recognize that many of these intersect. Our efforts are to strengthen community-based relationships, offering support to those in need in our communities. By offering resources, support, and education, we are taking an important step in reducing the impact of commercial tobacco in our communities. We thank you for being here to gain a better understanding of this issue and look forward to continuing to support communities to prevent initiation, support recovery, and create spaces for folks to seek those resources. Again, thank you so much.
Thank you, everyone, again, and please look out for the recording on our website. And I believe we will also be doing a mass email to all attendees of all presentations in the next few weeks with links to those recordings in case you were not able to join us on the day of that presentation. Thank you for everyone who attended this series, and to all our speakers and moderators, and to Natalie Pruitt at PPHA for providing really wonderful technical assistance throughout the series. Have a great rest of your day, everyone, and happy Pride.